which are kept in the uterine cavity, and they cause the endometrium to become unsuitable for fertilization. So basically, there are different generations. First one is obsolete one, which is called lipase lobe, or also called Grafen. And there is another called Grafenberg's ring, and basically it is made of a plastic, and it forms. It causes foreign body type reaction inside the uterus, which does not allow the fertilization and implantation to take place. Okay. Second generation are also called T devices. So they contain copper wire wound around a plastic which is shaped like a T, and so copper ions are released from the wire, which inhibit the enzymes in the endometrium. Uh, Inhibit steroid receptor, inhibit ovum transport, and elevate the fibrinolytic activity, and also depress the prostaglandin activity. So these copper containing devices are smaller and have less side effect and easily insertable. So the number denote the surface area of copper in mm². So there can be size A, B, C, and D, and newer are copper T220, T380, AG, Nova T, multi-load copper 250 and 375, and 200 can be placed for 4 years, Nova T for 5 years, 375 for 5 years, and 380A for 10 years. A represents in the AZ represents silver and A represents gold. Okay. So in third generation there is hormonal. Second generation was copper. Third generation is hormonal, progesterone hormone. So examples are progestasert, and LNG20. So this basically acts like hormonal contraceptives. There is a release of progesterone every day. So they act like progesterone only pills. Mechanism is thickening cervical mucus and makes endometrium atrophy and subsequently infertile. Fourth generation, they are frameless, have no plastic body, so sometimes they can only contain copper, like this, copper only, or they can contain hormone also. So what is the ideal candidate for IUCD? So IUCD is a long-term uh, temporary contraceptive. Ideal candidate is a woman who has already one child, who is not in a polygamous relationship, that is, has less chance of getting um, sexually transmitted diseases, has no history of those diseases, no history of PID or pregnancy, no pregnancy right now, and has regular menstrual. So commonest side effect is bleeding, but it will subside in 1 to 2 months, and you should give iron supplementation. And if it is a persistent bleeding, then you may have to remove the IUCD. Commonest cause of removal is pain. So commonest side effect is bleeding, and commonest cause for removal is pain. So contraindicated when there is a mass inside the genitalia, tumor, infection, ectopic pregnancy history, present pregnancy history, something new is growing inside the uterus. Just think that. Okay, tumor, microbes, baby, or if the cause is unknown for the bleeding, before ascertaining the cause of the bleeding, you should not insert anything inside the female genitalia. And relatively, this should be avoided in women who have amenorrhea, anemia, history of genital infection, discharge, and have deformed uterus like in fibroids or malformations. So, ideal candidate is monogamous, has one child, has no contraindications, and has can follow up. So it can be inserted anytime except pregnancy. Okay, like during menstruation or within 10 days of menstruation, or 1 week after childbirth, or abortion, or during puerperium.